So in June of 2016, myself, along with two other district chiefs and two other fire captains from the Bedford Fire Department, attended a class at the Massachusetts State Fire Academy on smoke, obviously the dangers of smoke, and regarding hydrogen cyanide poisoning from smoke inhalation. It was an all-day class, 6 or 8 hours, and during that time we became, aware of how dangerous and how lethal hydrogen cyanide poisoning from smoke inhalation was, and that how quickly it could, it could kill either firefighters or civilians that were trapped in a closed space fire, inhaling, smoke and superheated byproducts of combustion. So after that class, we became aware that there was a drug that was called Hydroxocobalamin that would help to reverse the untoward or bad effects of hydrogen cyanide poisoning and smoke inhalation. However, it had to be given, as soon as possible after the person was removed from the fire, because the hydrogen cyanide was already killing that patient, whether it be a firefighter or a civilian. So at that time, we met with the leadership of New Bedford EMS, began to develop a plan. We met with Dr. Matthew Bivens from St. Luke's Hospital, who is New Bedford EMS's medical director, and how we would like to be able to carry this drug, because it is approved by the Massachusetts Department of Public Health. It's just not a required medication to be carried on ambulances by paramedics in the Commonwealth. So he did grant us permission. He said to develop a training program and to come back to him when we had developed a training program, and if it was suitable, then he would approve it. We went back and forth for a few months developing what this, the parameters for when we should give it, when we should not give it, the signs and symptoms of it, how much we should give, dosing, who should get it, all the things that go into, being able to give a medication to someone. So after, a few months of going back and forth, we did develop, a protocol for its administration. We also developed a training program, which in March of 2017, we did do that training with New Bedford EMS paramedics and our paramedics here from the fire department, just to make them aware. That way they had an understanding of the drug as well. So in June of 2016, it actually was 2 doses of it are actually being carried on EMS-4, which is the EMS supervisor vehicle. So like I said, we have 2 doses that can be used for either firefighters or civilians. And it was recently used at a fire we had in the city here on Tinkham Street. And and you have to give credit to the first responders on scene, the crews from the fire department that began resuscitation on this patient, as well as New Bedford EMS Medic 3, their paramedics and their paramedic supervisor as well, Lacey Gomes. They were able to do advanced level care, and they were able to administer, it's the first time it was used on a patient, the hydroxocobalamin, and they were able to resuscitate her, and however, it did not have, the person ended up expiring. However, it did show that, this drug can be given effectively in the field, and what it does is it does give these people a chance to make it to a level 1, to be transported to a level 1 trauma center, and at least gives them a fighting chance, for survival, which in years past, decades past, these people would never have had a chance to even make it that far. They would have gone to the local community hospital and they would have expired there. Now we're giving them a chance to make it to that next level of care and hopefully increase their survival. But it really truly is a team effort between New Bedford Fire Department, New Bedford EMS, and Dr. Bivens as our medical director. We need all 3 parts of it to work, for it to all work together, and just gives an example that we can develop protocols or whatever for this drug, which can definitely be an X factor or a game changer in resuscitating someone that's been removed from a house fire and is suffering hydrogen cyanide poisoning from smoke inhalation.